Welcome to CureUp. Explore the complexities of brain tumor symptoms and causes in our informative video. Stay informed about crucial health topics with CureUp. What is brain tumor? A brain tumor is a growth of cells in the brain or near it. Brain tumors can happen in the brain tissue. Brain tumors also can happen near the brain tissue. Nearby locations include nerves, the pituitary gland, the pineal gland, and the membranes that cover the surface of the brain. Brain tumors can begin in the brain. These are called primary brain tumors. Sometimes, cancer spreads to the brain from other parts of the body. These tumors are secondary brain tumors, also called metastatic brain tumors. The information provided in this video on brain tumor symptoms and causes is for educational purposes only. Consult a qualified healthcare professional for accurate medical advice and diagnosis. Many different types of primary brain tumors exist. Some brain tumors aren't cancerous. These are called non-cancerous brain tumors or benign brain tumors. Non-cancerous brain tumors may grow over time and press on the brain tissue. Other brain tumors are brain cancers, also called malignant brain tumors. Brain cancers may grow quickly. The cancer cells can invade and destroy the brain tissue. Brain tumors range in size from very small to very large. Some brain tumors are found when they are very small because they cause symptoms that you notice right away. Other brain tumors grow very large before they're found. Some parts of the brain are less active than others. If a brain tumor starts in a part of the brain that's less active, it might not cause symptoms right away. The brain tumor size could become quite large before the tumor is detected. Brain tumor treatment options depend on the type of brain tumor you have, as well as its size and location. Symptoms. The signs and symptoms of a brain tumor depend on the brain tumor's size and location. Symptoms also might depend on how fast the brain tumor is growing, which is also called the tumor grade. General signs and symptoms caused by brain tumors may include headache or pressure in the head that is worse in the morning. Headaches that happen more often and seem more severe. Headaches that are sometimes described as tension headaches or migraines. Nausea or vomiting. Eye problems, such as blurry vision, seeing double or losing sight on the sides of your vision. Losing feeling or movement in an arm or a leg. Trouble with balance. Speech problems. Feeling very tired. Confusion in everyday matters. Memory problems. Having trouble following simple commands. Personality or behavior changes. Seizures, especially if there is no history of seizures. Hearing problems. Dizziness or a sense that the world is spinning, also called vertigo. Feeling very hungry and gaining weight. Brain tumors that aren't cancerous tend to cause symptoms that develop slowly. Non-cancerous brain tumors also are called benign brain tumors. They might cause subtle symptoms that you don't notice at first. The symptoms might get worse over months or years. Cancerous brain tumors cause symptoms that get worse quickly. Cancerous brain tumors also are called brain cancers or malignant brain tumors. They cause symptoms that come on suddenly. They get worse in a matter of days or weeks. Brain tumor headaches. Headaches are the most common symptom of brain tumors. Headaches happen in about half of people with brain tumors. Headaches can happen if a growing brain tumor presses on healthy cells around it. Or a brain tumor can cause swelling in the brain that increases pressure in the head and leads to a headache. Headache pain caused by brain tumors is often worse when you wake up in the morning, but it can happen at any time. Some people have headaches that wake them from sleep. Brain tumor headaches tend to cause pain that's worse when coughing or straining. People with brain tumors most often report that the headache feels like a tension headache. Some people say the headache feels like a migraine. Brain tumors in the back of the head might cause a headache with neck pain. If the brain tumor happens in the front of the head, the headache might feel like eye pain or sinus pain. Brain tumor symptoms by location. Lobes in the brain. The main part of the brain is called the cerebrum. Brain tumors in different parts of the cerebrum might cause different symptoms. Brain tumors in the front of the brain. The frontal lobes are in the front of the brain. They control thinking and movement. Frontal lobe brain tumors might cause balance problems and trouble walking. There might be personality changes, such as forgetfulness and lack of interest in usual activities. Sometimes family members notice that the person with the brain tumor seems different. Brain tumors in the middle of the brain. The parietal lobes are in the upper middle part of the brain. They help process information about touch, taste, smell, vision, and hearing. Parietal lobe brain tumors can cause problems related to the senses. Examples include vision problems and hearing problems. Brain tumors in the back of the brain. The occipital lobes are in the back of the brain. They control vision. Occipital lobe brain tumors can cause vision loss. Brain tumors in the lower part of the brain. The temporal lobes are on the sides of the brain. They process memories and senses. Temporal lobe brain tumors can cause memory problems. They might cause someone to see, taste, or smell something that isn't there. Sometimes the taste or smell is unpleasant or unusual. Causes: brain tumors that begin in the brain. Brain tumors that start as a growth of cells in the brain are called primary brain tumors. They might start right in the brain or in the tissue nearby. Nearby tissue might include the membranes that cover the brain, called meninges. Brain tumors also can happen in nerves, the pituitary gland, and the pineal gland. Brain tumors happen when cells in or near the brain get changes in their DNA. A cell's DNA holds the instructions that tell the cell what to do. The changes tell the cells to grow quickly and continue living when healthy cells would die as part of their natural life cycle. This makes a lot of extra cells in the brain. The cells can form a growth called a tumor. It's not clear what causes the DNA changes that lead to brain tumors. For many people with brain tumors, the cause is never known. Sometimes, parents pass DNA changes to their children. The changes can increase the risk of having a brain tumor. These hereditary brain tumors are rare. If you have a family history of brain tumors, talk about it with your healthcare provider. You might consider meeting with a healthcare provider trained in genetics to understand whether your family history increases your risk of having a brain tumor. When brain tumors happen in children, they're likely to be primary brain tumors. In adults, brain tumors are more likely to be cancer that started somewhere else and spread to the brain. Thank you for watching. For more informative videos, subscribe to our channel and hit the bell icon.